Welcome back to the Limitless Male Podcast. I'm Jessica Lonny, your host. Today we're talking about the vital importance of finding a specialist when dealing with men's health, particularly low testosterone and ED. We're joined by our medical director, Dr. Lonny Miller, who's going to take us through the medical side, but then also his personal journey with low testosterone to show us exactly how important it is and how to find your very own men's health specialist. Well, welcome, Dr. Lonny Miller. How are you?
Thank you. I'm doing well.
Good. So tell me a little bit about, you are the medical director for Limitless Male Medical. And how did you get there? Tell me a little bit about your background. MD.
Right.
Take your education.
Went to medical school at the University of Iowa, did residency in Fort Wayne, Indiana. And for most of my career, I worked in primary care, men and women of all ages. But in recent years, I focused my practice more towards men's health and performance.
What turned you towards men's health? You were talking about how they weren't really trained necessarily in men's health and that you wanted to dig a little bit deeper before we get into your patient.
Yeah. So at various speeches I've given or in telling the story, I jokingly say that in medical school, if you chose the wrong time to use the restroom, you might miss everything that they've taught you about testosterone and men's health. And I'm only half joking. So I found that later on in clinical practice, in my case, on the subject of testosterone, a lot of my colleagues, both family physicians and internists in my office, admitted that they had either no comfort level when it came to managing testosterone, or some were outright hostile to men that brought up the concerns of erectile dysfunction or testosterone. So I felt they were doing their patients a disservice, and I felt I was doing my patients a disservice by not being more proactive in talking about testosterone. I think that a lot of men's experience is when they finally get the idea and the courage to go talk to their primary care provider about low testosterone. They're either met by ignorance or hostility in their own experiences. So often they leave feeling like they were gaslighted or totally ignored with their concerns.
That's interesting because as a woman, I know that we also share those types of stories as well, that we have to advocate for ourselves. But hostility, we haven't experienced that in quite some time. We experience, you might just be hysterical or it's in your head, that sort of thing with a woman. But why do you think that men were experiencing kind of a hostile response with their primary care?
Well, I think some of that comes from decades-old misconceptions about testosterone. For a lot of providers, when somebody says testosterone, they think of the stories of abuse and misuse of testosterone that has, and that label just hangs over the head of virtually every man who seeks care or is on testosterone therapy. So they have to confront that bias. Nowadays, it's much like people with chronic pain. There are a lot of people who have chronic pain, but if you talk to every chronic pain patient, they will say the same story of every time how they're treated like an addict when they go in and meet with a new provider or have this concern about pain. Yeah, drug seeking. Yeah. So unfortunately, a lot of patients have the experience that as soon as they bring up testosterone, they're already prejudged by the provider. And the provider thinks they've seen too many shows on YouTube or whatnot that have talked about the issue, or they're trying to get it for secondary gain.
Interesting. And probably the same thing with ED or sexual health as well.
Exactly.
So it has that immediate misconception stigma to it. So you're in primary care. You discover that you have a passion. You have a tendency, a passion towards men's health. What's that turning point? Why do you seek this out?
In my case, I wasn't born with the passion for men's health or particularly testosterone therapy or erectile dysfunction. Rather, it came out of some of the revelations I had throughout my career. So again, a lot of the providers in my clinic express a lack of knowledge or comfort level with testosterone. And I thought, well, I'm going to do my patients a disservice if I don't understand this at a deeper level. So I did what any good clinician would do. I went to all the CME talks. I read up everything I could, all the guidelines, because I wanted to do right for my male patients. Unfortunately, a lot of those guidelines are very, very conservative, very limited. And what they teach you conventionally about treatment are protocols that are decades old that more often than not are inadequate to help control a man's symptoms. Now, being a good clinician and a good old family doc, I did what I could, and I thought I was doing right by following the guidelines. I patted myself on the back because I became more proactive in talking about men's health, and patients began to share that with others. So other people started seeking me out to have that conversation. But what I saw was being handcuffed by those decades-old guidelines and mental algorithms, if you will, on treatment of testosterone. My patients weren't getting the results that I hoped that they would achieve. Conventionally, if you look at the guidelines, a lot of them call for a cutoff for diagnosis of 300 nanograms per deciliter or less on 2 separate occasions. So more often, what would happen is those men would come in at maybe 302, 305, and me being a very evidence-based physician, I would confidently tell them, you do not have low testosterone. Yet they're right in front of me with all the same symptoms that somebody would have with a testosterone of 200 or 100. Really, hypogonadism or low testosterone occurs in shades of gray. That 300 is an arbitrary cutoff that came from research trials. That's it. They help to define a population for research trials. So too many physicians or clinicians that are well-intentioned are using that 300 cutoff as something from some religious text.
Right. Black and white.
Yeah. So I had a lot of men leave crestfallen that I would not treat them for low testosterone. And then if you did have low numbers, I would enthusiastically treat. But again, I was following what I was taught in medical school, residency, and what was in all the conventional textbooks. I would give them the shot of testosterone every 2 weeks. And if your testosterone got high, and I mean, as a side note, like 600, I would consider that like low end of therapeutic for most. But to me at the time, I thought, well, that's twice the upper limit of normal. We got to get that high testosterone down a bit. And conventionally, you're taught to put them on shots every 21 days or 3 weeks at that point.
Oh my goodness.
So patients were coming in and telling me the same story every time. Doc, I feel great for about a week. And then I go back to feeling like crap again. And I would focus in on that first part of that statement. You feel great. Good. I'm helping you at least half the time. But I didn't know what I didn't know.
Right. So
I thought my experience with testosterone therapy was the same across the board for other clinicians. If I'm following the guidelines, they are too. They're probably getting the same results. And tracking it over the course of a year, I would say about half or better of the patients that I put on testosterone would take themselves off testosterone.
Because they weren't seeing a consistent result.
Exactly. They were tired of doing the shots to feel good 1 week and feel like crap another. Why go through the effort if there's no reward? Right.
This isn't helping my symptoms. This isn't helping me feel better. It's just giving me a taste and then...
Exactly. So then one day, my office was about 2 hours away from Omaha. One of my patients drove the 2 hours and went to a clinic called Limitless Male Medical Clinic and decided to change his testosterone management over to that clinic. So when he came in to see me, he told me about that experience. And I asked, well, what do they have you on, or what are they doing different than what I was doing for you? And when he shared with me his regimen, I was incredulous. I looked at it and thought, what are they doing to you? They have you on what? Weekly testosterone shots? Like what is this?
Right.
It's got to be a bunch of charlatans. So I let him do his thing, and I kept treating him for his other medical conditions. Right. And 3 months later, when he came back for a diabetic visit, rather smugly, I asked him, how's that going with Limitless? The answer I got was not the answer I expected. He was enthusiastic. He felt great, like he had his life back again.
You're kidding.
That was the first crack in my armor. I think every clinician who follows the guidelines, who tries to do a good job, feels that he or she must be doing a good job and must know everything there is to know. Because I'd poured through the literature, poured through the textbooks, and was following the conventional course of testosterone management.
You did everything you thought you could do as a primary care.
Exactly.
You did all of the research, and you even went above and beyond.
Right.
And did some training that your peers would never do.
And in talking about his symptoms, entirely gone. He felt 20 years younger. But then I said, well, that's got to come at a cost. What about your side effects? He didn't have any side effects. And I thought, well, clearly they must be managing you to a very unsafe, super therapeutic level. He had his labs. They weren't. They were optimized for him. And that's the key. Is in medicine, you have to understand that we're taught as clinicians to fix numbers, right, if you will. When somebody comes in with a low potassium level, you do what you can to fix that potassium level. I just had a patient come in to the hospital last week. After a couple of weeks of diarrhea, she was left with low potassium, low magnesium. So I fixed the underlying cause of her diarrhea, and through IV supplementation and oral supplementation, fixed the potassium and magnesium problem. So a lot of providers look at testosterone as the same thing, that I got to get that number above 300, the diagnostic cutoff, and therefore the patient will be good again.
Right. In this arbitrary range that's set up in an archaic system managed by insurance companies that's okay, if you're in this range, you should be good. You're good. You're normal. You don't want to be above it. You don't want to be below it.
Exactly.
Just in this range.
And that's not just isolated to primary care docs who do testosterone management. I see the same thing with patients of mine that come to me that are with endocrinologists or urologists, that once they get that number in the high threes, they cut them off without regard to how their symptoms are doing. And
without regard to the fact that your levels fluctuate on a daily, hourly basis as well. So...
Right. It goes against everything we were taught in medical school, that treat the patient, not the numbers. And this is one case where virtually every clinician in the market who does manage testosterone is looking solely at the numbers without regard to what the patient's telling them. So it's no wonder patients get frustrated when their doctor isn't listening to them, even while they're on treatment. The doctors will think, well, I'm doing everything by the book. I'm doing what I can. You must be seeking. You must want something from this testosterone that it can't deliver.
Right.
So
you want to body build, you want to bulk up, you want to do all of these things. And I'm not going to help you do that.
And I would be lying if I said I didn't have that same bias in the beginning. But that one first patient, the mutual patient that I had with Limitless Male, to see the life and the vitality they were able to give back to him with their protocol opened my eyes. So interestingly, I became a testosterone patient simultaneous to all this. In my case, how I became a patient, as a physician, I was about 60, 70 pounds overweight, didn't exercise, didn't eat right. I found I had no energy left when I got home with my kids. I was like an absent father, and I was trying to be the best doctor I could, but I found myself falling asleep between clinic visits. And in the room, I just did not have the energy some days to listen to what the patients were telling me.
And you were still, you're young.
Right. Yeah,
anyway,
I was in my 30s at the time. So a lot of the symptoms I had fit with sleep apnea. So I got tested for sleep apnea, and lo and behold, I had sleep apnea, got that corrected, felt better, but a lot was still missing. What I wanted it to address was still there. I was still tired. I still had no motivation. My mood was low. Libido was low. Foggy. All of that was still there, but I was sleeping better. And I had to admit to myself what I didn't want to admit, and that was probably low testosterone. If I had a male come in to my clinic with the exact same symptoms, I would think nothing of ordering a testosterone level for him and doing what I could to improve it. But somehow for myself, making that admission that I may have low testosterone is like admitting to yourself that I may be less of a man than I thought I was. And I think a lot of men feel that way. And I was a physician who treated low testosterone When these men came to me with that problem, there was no judgment.
None.
I felt it was a medical problem I could help them with. But I think a lot of men like myself, there's some resistance to making that admission or even considering it as a possibility. So I struggled with whether or not I should even talk about it with my doctor. And when I did, interestingly, she confessed to me that I don't know how to manage this. Like, what do I check? What do I do now when the numbers came back? And my numbers were in the mid 100s.
Oh my goodness.
So clearly low testosterone. So together I had to educate her what scripts to write for me, how to manage it, when she should see me back to, and the finer points of testosterone management as I understood it at that time.
Right.
Still, again, at that time, how I was following testosterone management was less than ideal.
Right.
So for me, I got on a topical testosterone, and within a few months, like a lot of patients, they'll get very tired of applying that every day.
Waiting for it to dry so it doesn't transfer onto anybody.
Exactly. And on the days you don't feel like it, tough, you got to put it on anyway.
Mm-hmm.
So interestingly, I had a colleague that I talked with that one day said, hey, there's a company I know in Omaha that needs a medical director. It's a men's health clinic, and I know you like to do men's health. Would you be interested in hearing what they have to say? And I thought that, well, that would be a great opportunity. So in interviewing, eventually I got the position as a state medical director for Limitless Male. And I would have to admit, when I first started going to the clinic and working with the providers, what they were doing for the diagnosis and management of testosterone was nothing like I had read or seen before.
What was that like?
Well, part of me thought, like, what are these guys doing? Like, what are they thinking? But as soon as I would think that, I would go into the room with one of the providers, and I would be greeted with a man who was enthusiastic and happy that he had his life back. And it wasn't just a one-off. And I want to tell you, as a physician, if you have any burnout, go work at a men's health clinic like Limitless Male, because every room you go into is an appreciative patient, is a patient that has their life back, that will go in and have a success story for you. If they don't have that success story, it's because they're there for a new consult and have yet to get their success story. So the proof was in the pudding. And I still maintain some skepticism, even though I saw they were all being managed in a safe fashion. The providers had the patient's best interests in mind. It was just a regimen I wasn't familiar with. Now, if you look at it, the regimen that they placed patients on made sense physiologically.
Right.
It just wasn't in the textbook that I had read, and it was safe. So there was still that cognitive disconnect where I just could not quite accept it yet, that what Limitless was doing for patients was truly as good as it seems. Later on, I tried to expand my knowledge with everything that I could, reading the latest research studies, doing more training. And I went to a conference that was put on by Harvard Medical School on the topic of testosterone and men's health. And they talked about, again, the latest, greatest research, the newest protocols coming out. Every physician in that room seemed shocked about what they were hearing from the experts, the speakers, except for one guy, me. Because everything they were advocating for, everything that was cutting edge or based on the latest sound research, was exactly what we were doing at Limitless Male. So within the first few lectures, I texted one of my colleagues at Limitless that we are on the cutting edge of men's health. So from that moment on, I was sold. So that's when I became not just an expert in men's health and performance, but became an evangelist. Because I thought about each one of those patients that I saw at Limitless in one of those clinics was one man that had to get the confidence to go in and talk about it with a provider. And what you're going to find is Limitless Male was not typically the first destination for these men. They all had the same story, and it was all they went to their provider.
Yep.
They shared their concerns, and that takes a lot of guts to do. But they went to their provider and shared their concerns, and were either met with, I don't really know how to do that. The doctor begrudgingly would work it up, look it up quickly and on a clinical resource to figure out how to manage it, or would gaslight them. Tell them, well, you're 45. What do you expect? You're not going to have the libido. You've been married 20 years. You're working hard. You're not going to have the energy. What do you expect?
Or it's not testosterone, it's depression.
Right. Yeah, exactly.
You show all the symptoms of clinical depression.
Exactly. So they get put on an SSRI, which would ruin their sexual performance even worse. Great fix, doc.
Great, yeah.
So these patients were different. These patients were the ones that did not give up after being gaslighted the first time.
Right.
They knew that there's somebody out there that can help me. So I knew that for every patient that I saw in our exam rooms at Limitless Male, there's 1,000 others that either didn't get the confidence to go in, or when they got the confidence to go in, got gaslighted by their well-intentioned physician or clinician. Right. So that's when I became an evangelist, that we need to spread the message. Having low testosterone is way underdiagnosed. And for a lot of patients who don't go to a clinic like ours, is undertreated.
So that they tend to think that, well, this is just who I am, or this is how I am. Like you said, it was a failing, or to hear that you were hesitant to even go in and get your own diagnosis. Right. It's pretty surprising, just knowing your knowledge and knowing where you come from, knowing all of our men go through that same thing, that flip where they're solving a problem, where there is something wrong with them, but it's not a moral failing.
Right. And I do what I can to share that message with as many people as I can. At my clinic, if I'm seeing somebody for an unrelated problem, I will talk to them about their testosterone. If a man has that question about testosterone, I'm going to take that little bit of concern that he has and turn it into a conversation, because I want to know that not only is he being heard, but he's being heard by somebody who cares and knows what they're doing in this field. And you can talk to all of my coworkers and friends. If you stand still long enough, I will tell you about my low testosterone, what I did to fix it, and how good I feel now.
Right.
So fast forward 5-6 years now that I've been on testosterone therapy, I'm down 60, 70 pounds. I work out regularly. I have the energy. I work ungodly hours, but when I get home, I'm a husband, I'm a father, and I go until nighttime.
Yep.
And I get up early and I'm ready to do it again. I haven't felt this good since I was in my 20s. And actually, I work out more, and I probably am better health than I was in my 20s as well. I want every guy out there who can see some shared experience with mine to get in and get tested and get treated.
Exactly. And to know that they don't have to live this way. They don't have to suck it up. They don't have to just be tough.
Right.
That there's a pretty simple fix, as long as they're, like you said,
they're always told,
brave enough to come in.
What do you expect? You're getting older. It's a part of aging. Yeah, but it doesn't have to be. You don't have to accept that as a part of aging.
Correct. And you don't have to accept it in its full weight either, because we've had the conversation about women aging forever. I mean, it's a given fact, menopause. I feel, and you would know this better than I would, that menopause or the male version of this is just now becoming accepted within the last 5 years or so. And to know that not only can you help treat the symptoms, but you can feel better and you can live your life, I think that's amazing.
Right.
But apparently it makes a big difference on who you go and see. So instead of you go to your primary care, why is it important for someone to seek out, a man to seek out a provider who knows, not only knows what they're talking about, knows the cutting edge material, but believes in it and is a fan and, like you said, an evangelist? Why is that important?
That's really the $1 million question. Is there's only a few physicians within medicine, or specialties, if you will, that have any training in men's health. So primary care, urology, endocrinology. Beyond that, you really get no training. And unfortunately, those physicians and allied health professionals, PAs, nurse practitioners, are still being taught in the same manner, still being taught with the strict adherence to the guidelines and with treatment protocols that are decades old. So a lot of well-meaning clinicians feel that they are versed and comfortable with testosterone management. But knowing now what I didn't know then, I can tell you finding the right clinician to work with you as a partner for your testosterone is going to be essential. And that may be having a deeper conversation on the topic with your doctor. I know a lot of men feel very comfortable with their doctor. And if they want to go see their doctor for their high blood pressure, their diabetes, their asthma, that's fine. But that doesn't mean that your doctor is prepared and knowledgeable and enthusiastic to diagnose and treat low testosterone. So don't feel that you're going to offend that physician or clinician by going to a men's health expert. I think there's probably a few good questions that a man can ask to kind of figure out if who they're working with on their testosterone is a good fit.
Okay.
So first, when you bring up the topic, get a sense of how well it's received. Mm-hmm. If it seems like the conversation is only engaged begrudgingly by that clinician, stop right there, because you're not going to get the traction you need to have a serious conversation.
And you're just going to be selling them and proving to them why you have a problem.
Right. And share with the clinician. Now, I know this is an area that some providers don't have a good level of comfort. Do you feel comfortable managing testosterone? And I would say if you're dealing with an honest physician or clinician, about 75% of the time, they'll admit to you that, I don't really feel confident managing this because I don't see it often enough. That's a red flag, because they see it come into their clinic every day by the dozen.
Yes.
They're just not recognizing it.
Right.
So the eye will not see what the brain does not know holds true. So ask them again, do you feel comfortable managing it? And if they do feel comfortable, ask them, what are the treatment goals that you would have for me? Put that conversation back on them. Physicians will often ask the patient, what are you looking to get out of this? Mm-hmm. Because they're trying to fill you up and get an idea. Are you in it to get super therapeutic and get jacked? Are you looking for the wrong reasons? Or have you been watching too many Joe Rogan podcasts and think this is the cure-all?
Right.
So sometimes that starts a negative conversation. Flip it around. Ask the provider, what are your goals of treatment for me? Have the provider define what he or she is looking for to know that they're doing a good job. Because you're going to hear a lot of times a provider is going to tell you, like I would have years ago, well, I'm going to treat you. We're going to get that number up above 300. And there you go.
That's it.
They're treating the number, not the patient.
Right.
The answer you're looking for is we're going to increase your testosterone till we manage the symptoms that brought you in, mitigate any side effects, and do so in a safe manner. Make sure we don't go too high. Make sure that we're following your PSA. Make sure that we're otherwise keeping you safe. Make sure your hematocrit doesn't get too high. It's like flying a plane. You just don't look at the altimeter and out the windshield. You have to look at all the other gauges. You have to know what else is going on in that patient's body, because testosterone influences so many things. So when you get a good, well thought through answer, you know you're in good hands.
Right.
So that may take you cutting off your search and finding a men's health expert like at Limitless Male Medical Clinic. And if you're not in one of our markets and you're in another city that we don't yet serve, there are dedicated men's health clinics that specialize in this sort of thing. Do yourself a favor. If you have these symptoms as a man, get yourself checked out. You either have it or you don't. If you have low testosterone, that's straightforward enough to somebody who's confident and competent to get that ameliorated.
Right. And you don't know what you don't know.
Right.
Fantastic. This has been incredibly informative, Dr. Miller. It was wonderful to hear your origin story, and I think that everyone has come away with very useful tips on specifically what questions to ask a provider to make sure that they are actually working with your best interest in mind. So I really appreciate you stopping by, and I can't wait to have you back again on the podcast. So thank you very much.
Thank you.
Thank you for joining us today. Check out the show notes for more information or to download our free exclusive guide on finding your own men's health provider.